Everybody took a short break? Yes. Add water. Okay. We'll come to the second part of this session. Basically, the session is about what? Roles of IMG. What is IMG stands for? Indian Medical Graduate. Yes. And how many roles he has to perform, he or she has to perform at the end of their undergraduation? 5 roles. Clear? So, the progression of a IMG. So, to achieve this goal, what is the goal? Physician of first contact to the community who is globally relevant. Whether he is placed in the rural, urban, wherever he is put up, he should be globally relevant. That is the ultimate goal of this new CBME, that is competency based medical education. So, that is the ultimate goal of this CBME. So, for that, to achieve this goal, you have to perform these 5 roles most appropriately and effectively. To perform these roles, our curriculum has designed for all these 4.5 years. They have divided into different competencies that from first year till the final year. So, from first year till final year, there are different, you have to meet the competencies. To meet the competencies for each subject, for each topic, there has been a specific learning objective. So, for each topic or a subject, each topic there will be SLOs. So, it is called SLOs, it is called specific learning objectives. So, that means at the end of this session, for example, what is the topic of this afternoon session today? That is roles of IMG. So, what will be the SLOs for this? At the end of this session, all my students should be able to define what is the goal of IMG, what IMG stands for, and what are the roles of IMG. So, the 5 roles of IMG. So, this is the learning objectives of this session. So, this is how for the each topic of the each subject from MBBS phase 1 till the final year, the objectives are created. Already the objectives are specified to meet that particular competency. So, that competency are designed in such a way so that the 5 roles of IMG is met like appropriately and effectively to ultimately to meet what? To meet the goal of this competency based medical education. Clear? So, this is the progression towards the IMG, progression to IMG. So, objectives, competency, role and ultimately goal. Clear? Now, coming to the next part. So, you all must be knowing, I am just talking about the present curriculum, that is the competency based medical education. So, at least to know about the present curriculum, you should know what was previous, isn't it? So, any patient if they come also, you ask the past history, isn't it? So, the same way you should to know the difference, to know the advantages as well as the to know how does this new curriculum differ from the old curriculum. So, you should know the demerits of the old curriculum and what are the merits of this curriculum. Ultimately, what is the good about this? Why they changed? There was a sudden shift in the medical education. There was a paradigm shift of a medical education from the previous to the current curriculum, isn't it? So, any idea? I think you must have interacted with many of your relatives must be a doctor, yes or no? Maybe your relatives, friends or your parents, your uncle, aunt or grandfather must be by profession they may be doctor. So, they must have told you how it was, all that. Anybody has any idea what was the previous curriculum was all about? Any thoughts? Whoever, whatever you heard, please, can you just tell? What curriculum? Yes? So, before going to the merits and demerits of the current curriculum, we'll go for the, how was the previous curriculum was all about. Which was the major demerits to change the curriculum, to change this, like, that paradigm shift of the medical education was due to the demerits of the previous curriculum. Anybody? Yes? Sorry? Can you come back? Can you pardon me, please? Very good. Thought taken. So, the previous curriculum was more of a theoretical. The present curriculum is with a more exposure towards the clinical exposure. Yes, one. Any other thoughts? Yes? Yes? In which previous one? So, okay, it was not, the students found it difficult. It was not prescribed. It was not, yeah, all right. It was not very clearly mentioned which are the books, the reference books and the textbooks and all right, compared to the present curriculum. They are very specific, all right. Any other thoughts? Any thought? There's nothing like you are right or we are all lifelong learners, isn't it? So I learn from you, you learn from me. Any thoughts? All right. So you mean to say the fresh doctors who just graduated are difficulty in communication with the communication skill part of it in treating the patients. All right, thought taken. Yes. Any other thoughts? Anybody? Everybody is sleeping? Good afternoon. Good afternoon. At least you can say good afternoon, right? I am unable to hear you all. Yes. Good afternoon, ma'am. Is that so? Or good afternoon, ma'am? Yes? Okay, I'll say 1, 2, 3 together. Everybody should say good afternoon, right? That I should be able to hear. Okay, ready? Not now. Not now. Now I'm going to wake you all up. Okay, I'll say 1, 2, 3. Everybody should say together. Okay, 1, 2, 3. Yeah, okay, thank you. All right, so all are awake. All right, good. Okay, fine. Yeah, we'll continue. Any other thoughts related? Any other thoughts? So, we'll come to the demerits, all right, of the previous curriculum. It was more of a theoretical, that is, becomes a theoretician rather than a clinician. What is the first role of IMG? To be a physician, that is clinician, isn't it? So, previous curriculum was more on the theoretical based, and ultimately theory, if it is good, means that will help for what? For 12th, for getting into NEET and entrance. So, the previous curriculum was based on he achieves high marks in the exams, he score well, but ultimately targets what? Ultimately after he passes, you should click the PG entrance examination, but fails miserably to serve the need of the community as a basic family physician. What I told, IMG should be able to perform at the, what is the goal of IMG? He is a first contact physician to the community who is globally relevant. That is, he fails miserably. That's what they learned over the period of years, the medical education. So that's why they had to shift from the previous curriculum to the present curriculum. So what is good in present curriculum is it includes teaching something of everything. Teaching something of everything, because after MBBS, wherever you may be posted, rural or a urban, anywhere, any nook and corner of the world, you should be able to manage. So ultimately, which is globally relevant. So that is also equally important. So that's why this includes teaching something of everything. And second, it covers a comprehensive knowledge base, which is ultimately in that 4.5 years, it is designed so beautifully that it provides a comprehensive knowledge base from the first year till the final year to achieve the goal of the IMG. Next, it is time bound. So one can plan the future. It have introduced electives, they introduced many different modules, so that the IMG, after the end of their 5.5 years, they can plan their future, what they want to become. So that is how this curriculum is designed. And students will not remain under the impression that one day I will learn. That won't work in this current curriculum, that is competency-based medical education. This doesn't work, okay, which could be possible if it is time-free. Like, one day I will learn. Whenever I get time, I'll learn. That doesn't work in this curriculum. You have to learn in that particular time. Next will be, it provides a wide knowledge base throughout the 4.5 years, and learners can build their practice. Gradually, the learners, you are all learners, isn't it? We are all learners. So, we can build their practice. Like, it builds up year by year. So, these are all the good part of this present curriculum. So, present curriculum is what? CBME. C stands for competency, B for competency based medical education. So, the present curriculum is what? CBME. It is what is the goal of CBME? To produce a IMG, to offer physician of a first contact to the community who is globally relevant, who performs appropriately and effectively the 5 roles. So, which are the 5 roles? 1, physician, 2nd, leader, 3, communicator, 4, lifelong learner, and 5 is the professional. Clear? So, this is about the CBME. So, from the previous year, this is the new curriculum has been implemented. So, what are the differences between the old curriculum and the new curriculum? So, old curriculum was based on traditional method of teaching. New curriculum, that is the CBME, is student centric. The old curriculum is teacher centric. I listen, you have to, I give lecture, you have to listen. There was no way interactive sessions much. The teaching learning method was didactic lectures were more. So that was the old curriculum. So old curriculum is traditional method of teaching. The new curriculum is the student centric. The old curriculum was teacher centric. The new curriculum is student centric. That is the first difference. And the variable for the old curriculum, that is the basically driving force of curricula is the old curriculum, that is the traditional method. It was basically on the content based, whereas the new curriculum CBME is outcome based. This is very important. And second is goal of education encounter in traditional education, it is knowledge acquisition, just gaining. Theoretically, you will be knowing everything. Here, not only that, here they more concentrate and emphasize and reinforce on knowledge application. The new curriculum is based on knowledge application. The third variable is type of assessment tool. So, in the traditional education, it is single subjective measure, whereas the present curriculum, it is a multiple objective measure. And the assessment tool, it is proxy. You can again do it, whereas the competence based, that is the present curriculum, it is authentic and almost mimics or simulates the real task of profession. So, that is about the new curriculum. And the fifth variable is setting. The old curriculum, that is the tradition method, it is removed. That is, gestalt means what? Means around, what do you mean by gestalt? That means when we do, for example, first year subjects, there are 3, first year till final. First year is 3 subjects: anatomy, human physiology and biochemistry. Individually when you teach, whatever the result you achieve, together if you integrate and teach, the result, the achievement is more. So, that is what it is, ultimately the gestalt, that is individual, that is removed. Now, it is an integrated teaching. So, that is direct competence based, is based on direct observation. Next is focus on assessment. This for traditional curriculum education was non-referenced, whereas the new curriculum, the present curriculum, it is criteria reference. Next, the assessment was traditional curriculum education emphasizes on the summative, means at the end of first year, like that, whereas the present curriculum, that is CBME curriculum, it is formative. So, that means at a regular interval, the internal assessment will be conducted. So, it is a formative mode of assessment for the present curriculum. And the old curriculum, the program completion was a fixed time. So, but the present curriculum, it's a variable time. So, this is the main differences between the good old traditional method or the traditional curriculum and the present new curriculum, which is nothing but competency based medical education. Overall, what the old or the traditional method was teacher centric. The present curriculum is student centric. To keep the student into consideration, and depending upon their curriculum is designed. So, why was the paradigm shift in the medical education ultimately done? For making doctors to, before also they were making doctors, isn't it? We all together, what all we became. So, we are making doctors to good doctors. That's the reason for making doctors to good doctors. There was a paradigm shift in medical education, the sudden shift, isn't it? So, what is happening? So, medical colleges train students with the knowledge as well as the technical skills. What is expected? Graduates commit high degree of professionalism. What I told professionalism, again the last role of IMG, ethically, you understood? So, the same thing. So, ultimately the graduate who is coming out is commit to high degree of professionalism. Concerns about doctors, adequacy of scientific education and clinical skills, commitment to improve healthcare and provide leadership. So, these are the changes they did for making doctors to good doctors. So, what all they made? They made medical colleges train students with knowledge and technical skills, and graduates commits to high degree of professionalism and scientific education and clinical skills adequacy, as well as commitment to improve healthcare and provide leadership. I told in leadership the statistics part and contributing to the ultimately to the community. So, this is one part. Second part is the paradigm shift was done, especially from shifts from theory to practice. What I told, the traditional method of curriculum was more of a theory based, theoretician is producing, more of theoretical. Now it is practice. So theory to physician. So shifts from theory to practice, means from teacher center to student center. Second, from theory based to scenario based, means what? Before, like, for example, whenever we used to take our lecture classes, how our teachers used to take, this to come start with a topic. Look, today I am going to take a class on hypertension. So what is hypertension? Everybody must have your parents or your grandfather, auntie, uncle, they must have BP, they say, right? I have BP, you must have heard at least that. BP means increased blood pressure. Everybody should have BP, even I have BP. But at a layman language, BP means what? It's like increased in the blood pressure than normal value, isn't it? So I have sugar, means what? I am a diabetic. Everybody has sugar, isn't it? Other than increase more than the normal value, that is a diabetes. So like that. So how previously they should just start BP, hypertension, whatever the definition, and later causes for it, and what next subsequent, they used to teach the pathophysiological part, later the investigations, and last will be the treatment. So now how they have changed? That case based. Basically, it is the scenario based. They will give a history. When the first, only before starting the class, will give you a scenario. A patient comes with a history of recording increased blood pressure, will give one value. So everybody will be aware about the normal value. We'll give there is a change in the value we give. Then we start with the what is wrong with this like scenario. You think it's a normal, or there is any change in the variable or the reading. Then we'll come to the what is the topic. So this is how they change, scenario based, and from hospital to community based. Before it was just hospital. Okay, now it came only those topics. Now this is not. The curriculum is designed ultimately the community based. Means what is the evolving new problem, based on that the curriculum is designed. For example, now what is the major everybody, what's the problem right now? It's a corona, the second wave. What is that? Rupantara. So now the community, the problem is what? The second wave. So now it is based on that, the curriculum, the topic, again that about that virus, the structure that will be designed. So community, based on the community requirement, the curriculum will be next year. Yes, you will be this after first year, second year you will have extra topic coronavirus, like that. Clear? It's a community based. Next, from solo to teamwork. The present curriculum is entirely on the teamwork, so that the efficiency will be better rather than the individual. So the present curriculum is based on the teamwork rather than doing individually. Ultimate outcome they have seen is better with the teamwork. So we can allot the roles, individual we can delegate the work, and as a team if you work together, ultimate effect or the treatment or whatever outcome will be better. So this curriculum is based on that teamwork rather than the solo. Next will be from solo subjects to integrated learning. So for example, first you used to read anatomy, physiology, biochemistry, finished. Then you used to go to second, then you used to go to final year medicine. That was the previous curriculum. First year, second year, third year, fixed. Now it is not like that. You from the first year onwards, you are exposed to a department of medicine, and we have the integrated teaching among the preclinical subjects, that is anatomy, physiology and biochemistry. That is the horizontal integration, and the vertical integration with that of the other departments from second year till the final year from the beginning of the course. That is from the MBBS phase 1, which was not there in the previous curriculum. So integrated teaching together, ultimately understanding and the outcome for ultimately what? All this design for ultimately to achieve the goal. What is the goal? A physician of first contact to the community who is globally relevant. Clear? That is to achieve that goal, to perform all those roles. Next is from pieces to complete picture. Ultimately what? Overall development. Okay, overall development of the IMG to perform those 5 roles. So, changing role of a teacher, that's very important. Before the previous curriculum, it was a teacher centric, means didactic lectures. I come, I teach, I take a lecture for an hour, I write and I leave. So, it was more than a one way with a few questions in between, because we are supposed to finish so much syllabus in prescribed time. It was like that. So, that was how it was. Now, it is the teacher is no more, he takes a didactic lecture, except certain topics where there is a large amount of the theory has to be covered. So, those type. So, that is also specified in this new curriculum. The teacher role, he is not just to tell or give knowledge. He should act, his main role is to facilitate learning. Means we act as a facilitator. We make you think. We have to make you think what is wrong, what is good. Along with that, how, what, all that we facilitate the learning rather than just giving the facts and making you memorize. That is not the role of teacher anymore like previous curriculum. So, who are good doctors ultimately? So, the good doctors are take care of patients as their primary concern. Yes or no? Ultimately, that is what. If you have like your kith and kin or your parents or anybody, if they have fallen sick, if you go to a physician or a surgeon, anybody, or a pregnant lady to an obstetrician, their first concern should be the patient care. That should be that. Then they are called a good doctors. So take care patients as their primary concern. 1, 2 are competent. They should be competent. They should be accountable for their, responsible for their treatment. They should be competent enough to discharge their duties. Next, keep their knowledge and skills up to date. They have to keep updating. So they cannot, for example, when I was small, for running nose or allergic rhinitis, they used to give CPM, Avil. Now, there are newer drugs. Nowadays, Montac LC, many newer drugs come. So, like that, they have to, again, knowledge and skills have to be updated. Before, there may be different way of suturing was there. Now, the method of suturing, there are newer techniques. Stapler has come so many. They are different. So, you have to update. As I told, robotic surgery, from open surgery, it has come to laparoscopic, from laparoscopic to again to robotic surgery. So, in that level, so you have to keep updating the skills as well. Establish good relationships with patients and colleagues. Very important. You have to have a good communication. That's why the role is communication is being specified, because you have to establish a good relationship with the patients as well as the colleagues. Why you have to be good with the colleagues? Otherwise, you cannot work well as a team. If you fail to work as a team, then ultimately efficiency will come down. So, outcome is for the primary patient care. For that, all the roles have to be performed appropriately and effectively. So, establish good relationships with the patients and colleagues is also equally important. And the doctors who are honest and trustworthy. That is very, very important. And before entering this medical college, you please learn this and come. This you have to start from day 1. What you sow, that you reap. So be honest and trustworthy. Err is human. We tend to do mistakes, but it doesn't mean that you manipulate, right? You always, all complications, that risk will be always there. You can always justify and try to correct it and try to do what possible, what best you can do, then everybody will understand. For that, you should be honest as well as the trustworthy. And you should act with the integrity. You should never lose your integrity. That is the main important thing to call as good doctor. Next, most important, the doctors who listen to the patient's view. It is very important. You should not talk. You don't know, keep a patient will be expressing their agony with their symptoms, with what all they are undergoing. Just because you could, you could think what is the problem with them, you should not suppress them. You should think from patient's view. Okay, they are trying to, okay, listen. So you should listen and always think from patient view, not from your view. Then you are called a good doctor. Next, can negotiate treatment plan. So as per the ultimate care should be what? Your primary concern should be patient care. Not just because patient told I'll do no. As per the, for this patient you know better. You are trained in this. They do not know. So you should be able to negotiate the treatment plan correctly. Then only you will be called good doctor. Clear? So this is the overall design of a new curriculum, that is the present curriculum, which is competency based medical education. Just one example for this, that is here they have given management of hypertension. Hypertension means increased in the blood pressure. You will all read. I am just giving overall view, just one example I have taken, simple example. First year, second year, third year, fourth year, MBBS. Phase 1, phase 2, phase 3, phase 3, part 1 and part 2. So, overall, this is MBBS phase 3, part 1 and part 2. Okay, in first year, and at the end of first year, you will be all joining in February. By the end of, I think by July, I don't know when you will be like taking the exam, September I believe, September, October. So at the by end of first year, you all should be able to define the blood pressure and describe the mechanisms which is involved in regulation of blood pressure. All that you learn. For example, in first year, at the end of that, you should be able to meet so and so. Next, second year, you build on it. That is again, describe the pathophysiological mechanisms. Don't go into the terminologies. You have 4.5 years, all details about the terminologies subsequently you will learn. Okay. So, and enlist the drugs for the treatment of high blood pressure and describe these drugs. Means basically in second year, you build on to that. First year, just know the definition, what things where it varies and how it is regulated. Second year, what are the abnormalities, what are the drugs available to treat that disease. Your disease is the hypertension. Clear? Like that. And what's wrong? Like that. So, that is what you are going to learn here. And the third year, ultimately in part 1 you learn which is the appropriate line of treatment. So again there are different treatment modalities, medical line of treatment, surgical line of treatment, you know. So again first line of drugs, second line of drugs, like that, first choice, second choice, it will be there, isn't it? Option A, option B, like that. So you will learn the, especially the appropriate line of treatment in the MBBS phase 3 part 1, and ultimately part 2 you will be able to learn appropriately to manage a case of one disease, that is the hypertension here. Example I have taken as hypertension. Ultimately, you will be able to manage the disease. So, this is how the new curriculum is designed. So, first year, second year, final year, part 1 and part 2. So, ultimately, the proposed undergraduate medical education program is designed to create an what? Indian medical graduate. So, the proposed UG curriculum, which is based on what? Competency based medical education. CBME is ultimately proposed to design to create an IMG, that is Indian medical graduate. The Indian medical graduate will have the necessary competencies. Which are the competencies he will have at the end of 4.5 years? He will be having, he will be well versed with the appropriately, you know, and well versed with the knowledge, skills and attitude. These 3 competencies in all the subjects he will be having to assume his or her role as a healthcare provider to the India and the world. That's why it is called globally relevant. So ultimately, India to the world. So the goals of MBBS training program are to create doctors with requisite knowledge, skills, attitude, values and responsiveness, so that they may function appropriately and effectively as a basic doctor, physicians of first contact for the community in the primary care setting both in urban as well as rural areas of the country. This is very, very important with the bare minimum facility. Bare minimum facility, where will be that in PHC, Primary Healthcare Center. After you finish MBBS, wherever you are placed, with the bare minimum facility, you should be able to perform all these competencies. You should be able to do and perform your roles. So that is the ultimate goal of this new curriculum, which is a competency based medical education. So overall, what is the this session is all about, to summarize, it is basically in order to be locally relevant and in turn globally competent. Locally relevant and globally competent. So this is how it is designed based on the community requirement. This curriculum is designed. So to make this, to perform this, IMG's role should be required. How many roles? 5 roles. Which are the roles? Clinician, leader, again communicator, and lifelong learner, professional. So that ultimately you can perform this. Clear? Want to see? The best way to find yourself is to lose yourself in the service of others. I think you can see. Father of our nation, Mahatma Gandhi. Any questions, please? No? So today's day 1 foundation course we completed. Please feedback. Everybody, I think the link has been sent. Please complete your feedback, and depending upon the feedback, your attendance will be taken. Depending upon, based on that. Okay? Feedback link has been sent? Yes, it is sent. Please start. Oh, questions? You have questions? Yeah, ready to take up the questions. Yes. They are giving the feedback settings. They are giving the feedback settings. Thank you.